A very warm welcome to everyone. Today we are going to discuss about periodontal instruments, and I am Dr. Devapriya, Professor in the Department of Periodontics, SRM Dental College, Ramapuram campus. So basically, a periodontal instruments can be classified as periodontal probes, explorers, instruments used for scaling, for root surface debridement, periodontal endoscope, and instruments used for cleaning and polishing. Basically, when you look at an instrument, periodontal instrument or any instrument, the parts are described as handle, shank, and working end. So handle is the part wherein we grasp the instrument, and working end it can be it's different for a cutting instrument and for a non-cutting instrument. That is that part which is used for like diagnosis or for therapy, and shank is that part which connects the handle with the working end. So working end of a cutting instrument is a blade, whereas working end of a non-cutting instrument can be a mirror, like in the case of a mouth mirror. It can be pointed, like in the case of an explorer, or it can be a calibrated rod, like in the case of your periodontal probes. Parts of the instruments, we'll first talk about the handle. The handle of the instrument can be hollow handle or solid handle. And when you tell it is hollow, hollow is meaning that the center of the instrument, that is the core, is filled with air, so it allows for better tactile sensitivity. Solid handle instruments a little bit bulkier and completely made of metal. So the instrument handle can also be explained as plain or smooth, or it can be textured or knurled. So all this favors better grasping and better control of your instruments. So the shank is further classified as simple or straight shank, compound shank, and complex shank. So whenever we are instrumenting in the anterior areas, we prefer simple or straight shank or the compound shank. And as we go posteriorly, for better accessibility, we prefer complex shanks. So there are more contra-angling in your shanks. So coming to the parts of the blade, it's described as the face of the blade, that is the front surface alongside the shank. The terminal shank is the face of the blade, the back of the blade, and between the face and the back you have the lateral surface, and between the face and the lateral surface we have the cutting edge. So going to the individual instruments, mouth mirror, the most commonly used instrument. Okay, the mirror can be fixed or it can be detachable. It can be a plain mirror, convex mirror, or a concave mirror, and it can be a front surface mirror or double mirrors can be used. The mirrors are of different sizes, like we tell it as number 3 mirror, number 4 mirror, number 5 mirror. And we also have mirrors wherein we have mouth mirrors with inbuilt light. So uses of mouth mirror will be for indirect vision, indirect illumination, trans illumination, and diffraction. Explorers, the most commonly used explorer is number 17 explorer and number 23 explorer. Then as a single instrument, if these two explorers are combined, we call that as a number 5 explorer. Explorers are used to locate deposits like plaque and calculus and to locate dental caries. Periodontal probe is an instrument that is used to locate or measure pockets, determine the course on the individual tooth surface, used to measure sulcus depth, measure clinical attachment levels, width of the attaching gingiva, to evaluate for the presence of bleeding, measure the depth and width of gingival recession, and to measure the size of the oral lesions. This is a clinical picture showing probing using a periodontal probe. So the periodontal probes may be divided into 5 generations. The first generation probes are conventional manual probes. The second generation probes are pressure sensitive probes. Example will be a PPI probe. Third generation probes are computerized probes like your Foster Miller probe, your Toronto automated probe, your Florida probe, which can detect the cemental enamel junction. The fourth generation probes are the 3-dimensional probes in which sequential probing positions are measured. And the fifth generation probes are ultrasonographic probes which provide painless probing to the patient. So now we are seeing what the picture that is focused is Williams periodontal probe, wherein there are markings from 1 to 10 millimeters with 4 and the 6th marking missing. If this is a marked color coded probe and the calibrations are in 3 millimeters marking, 3 millimeter, 6 millimeter, 9 and 12 millimeter. Next we have the UNC 15 probe, the calibrated rod. The markings are from 1 to 15 millimeters and we have black marking at 6th, 10th and the 15th millimeter. Cyclian probes are two types of probes. You have the clinical cyclian probe and the epidemiological cyclian probe. So you have a wall tip of 0.5 millimeter in diameter at the tip. Then you have marking blood bank from 3.5 to 5.5 millimeter and from 8.5 millimeter to 11.5 millimeter. Neighbor's probe, again you have marking at 3 millimeter, 6 millimeter, 9 and 12 millimeters, and it is used to evaluate your fructation involvement. This is a picture of a PPI pressure sensitive probe. This is a picture of the Florida probe, and these are plastic probes used for probing around your dental implants. So I'm now going to the scaling and use of these dividing instruments. You have your sickle scalers, your hose scalers, your file scalers, your chisel scalers. Okay, so this picture that is projected is your supragingival scaler. They're used for removal of your supragingival plaque calculus. Used to remove large calculus deposits from the enamel surface, usually the full stroke. Sickle scalers with straight shanks are used on the anterior teeth, and sickle scalers with contra-angling shanks are adapted to the posterior teeth. This is a picture of your hose scalers. For scalers, the blade is bent at 99 degrees. The cutting edge is beveled at 45 degrees. The instrument is activated with a firm full stroke towards the crown. File's primary function is to fracture or crush large deposits of tenacious calculus. Next, you have your curettes. Curettes are used for deep subgingival scaling and for root planing your altered cementum and for removing the soft tissue lining of the periodontal pocket. Curettes are finer than your scalers, hence they are used subgingivally. And the working end of the curette, that is the blade, is rounded and it is referred to as toe, unlike your scaler with a pointed tip. Curettes can be universal curettes or area-specific curettes. So universal curettes are curettes wherein the design is such a way that it can be used on all surfaces of the tooth or all areas of the tooth. Area-specific curettes are specific set of instruments for specific regions of the tooth. So what is the difference between Gracie curettes and universal curettes? Gracie curettes actually a set of many curettes designed for specific areas and surfaces, whereas universal curettes are a single curette or one or two curettes designed for all areas and surfaces. So cutting edge of a Gracie curette, only one cutting edge is used, whereas for universal curette, both the cutting edges are used. The blade of the Gracie curette is curved in two planes, whereas the blade of the universal curette is curved in one plane. And the Gracie curette, the blade is set at an offset angle, that is 60 degrees to the shank, terminal shank. Whereas universal curette, the blade is not offset and the face of the blade is beveled at 90 degrees to shank. So these are the set of area-specific curettes with 15, 16 and 17, 18 as modifications. So Gracie 1, 2, 3, 4 is used on the anterior teeth, 5, 6 is used on anteriors and premolars, Gracie 7, 8, 9, 10 is used on posterior teeth, facial and lingual surface, Gracie 11 and 12 is used on posterior teeth, mesial surface, and Gracie 13, 14 is used on posterior teeth, distal surface. So next you have modification, that is after-5 curettes. In after-5 curettes, the terminal shank is elongated by 3 millimeters so that you can have better access to deeper pockets on the posterior surface. The blade is thinned by 10% to ease insertion into the periodontal pockets. Next you have the mini bladed curettes, which are your mini 5 curettes. The blade length is reduced by half when compared to your after 5 or standard Gracie curettes. So this is a picture showing the modification in the shank length and blade length of your after 5 curettes and your mini 5 curettes. Next you have your Langer curettes, which are a modification of or a combination of Gracie's shank with universal curette blades. You have Gracie curvettes, wherein the blade length is reduced by 50% and there is more blade curvature upwards. Okay, and you have a straighter, longer terminal shank. So you have your Petting's fructation curettes, which are used to remove calculus from the fructation areas. Next, you have your Schwartz stereotrievers, which are a set of two double-ended, highly magnetized instruments. Whenever your curette tip breaks within a periodontal pocket, these can be used to retrieve the broken instrument tips. Next, you have your scalers, your ultrasonic scalers that we use in our dental clinics. There are two types, piezoelectric and magnetostrictive. Next, we talk about the dental endoscope or the perioscope. Perioscope actually has a tiny camera that allows the dentist to visualize the root surface and visualize the deeper pockets. The perioscope, it is attached to a camera and the light source that produces image on a flat monitor. So the endoscope is fitted with a disposable sterile sheet that will deliver water irrigation, and this endoscope can be fitted onto a probe or a ultrasonic instrument kit. So this is a picture of a periodontal endoscope. Next, cleaning and polishing instruments. The idea of polishing an instrument is polishing is to remove stains, smoothen the teeth surfaces. Instrument use can be a rubber cups, a bristle brush, a dental tape, your air powder polishing. So this is a picture showing your rubber cups and dental tapes, which are used for polishing the proximal surfaces. You have your bristle brushes, which you can use with your polishing paste. Then finally, you have your air powder polishing, that is Profijet. It is used for removing extrinsic stains in soft deposit. It uses a slurry of warm water and sodium bicarbonate. So the slurry removes the stains rapidly and efficiently by mechanical ablation and provides warm water for rinsing and lavage. So thank you everyone for the patient listening.